Hi, I'm Dr. Weniger at Weniger Plastic Surgery. Almost everyone has some fat they want to get rid of, right? But liposuction isn't really for all those situations. Some patients are overweight and they're going to be better off with diet and exercise. But if you have a particular area or areas that even with weight loss you can't get rid of, then you're a good liposuction candidate. The most common areas that we do liposuction on are certainly the tummy and the love handles, but also inner and outer thighs, double chin, bra rolls under the arms, and even a roll that people can have right in front of their armpits. Usually, when we suction these areas, we just throw the fat away. But sometimes we can actually use it to graft or inject into other places, usually the buttocks, but sometimes even the breasts for a natural breast augmentation. If we're doing small areas, let's just say a little bit in the saddlebags or something like that, or under the chin, we can just do that in the office with some oral sedation like some Valium and some local anesthesia. More often though, we're doing larger areas or multiple areas, so of course we have to go to the operating room. Now, the limits to how much we can do at one time really have to do with safety issues. We really don't want to operate any more than 6 hours in a cosmetic situation, and we're limited also in an outpatient setting to not taking more than 5 liters of fat. Now, sometimes we'll combine liposuction with other surgeries, such as a tummy tuck or breast augmentation, so we have to take that all into account, making sure that you can get the results you want, but we have to keep it safe, because it is cosmetic surgery after all. Now, patients a lot of times are worried about the recovery and are surprised to find out that liposuction has a pretty quick recovery. It depends on how much you're doing. If it's a smaller area, let's just say the love handles or hips, patients are going to be back to work usually after just a weekend. Of course, if you're doing a larger area, tummy, inner thighs, love handles, maybe outer thighs, bra rolls, you might be looking at maybe 4 or 5 days, probably even a week to get back to work. But I do want you exercising or active right away. Day after surgery, I want you outside walking. I like when patients come in a week after surgery, they're already getting in 3-4 miles a day. That's excellent. But if you want to get into more aggressive exercising, running, cycling, I'm thinking usually about 2 weeks. Although there are some patients who have a lot of swelling, bigger surgeries maybe, and they might be better off waiting to get into more aggressive exercise till 4 weeks. But most patients, it's a lot shorter than that. Now, as far as recovery, you need to know that for the first few days, you're going to have a compressive garment on for 4 to 6 weeks, but for the first few days, you're going to have to leave the garment on, and there can be some oozing from the incisions, but after that, you're taking it off and taking a shower. You just can't swim or go underwater for a few weeks. But we see you in the office to make sure everything's going well at about 3 or 4 days. Then usually the week after that, and then you have a 6-week visit for photos, and then a 6-month visit. Pretty much by that time, all the swelling's gone, and we can see the final product. So I'm Dr. Weniger talking about liposuction. You want to visit us at www.wenigerplasticsurgery.com.